So I'm going to tell you about John. John's a 65-year-old retired gentleman. He lived alone, and unfortunately he was diagnosed with laryngeal cancer, so cancer within the voice box. And he had chemoradiotherapy to start with for that treatment, but unfortunately he had local recurrence of laryngeal cancer a year later, and that meant he had to have that surgically removed. So surgical removal of the voice box, a larynx, is called a laryngectomy. And he also had the tube of his throat where you swallow, pharynx, removed as well. And he had some tissue from elsewhere in his body to recreate a new tube for him to swallow in that surgery. And because his voice box was removed, he could no longer produce voice like the general population can. And speech pathologists like myself are heavily involved with these clients before they have their surgery in terms of providing education and counselling and talking about the options after surgery. And we're also heavily involved in that post-operative rehabilitation. So for communication, particularly how they produce a voice and they talk, as well as their swallowing and airway management. So with just quickly, in terms of that surgery, there's different options for people like John. There can be a device, a vibrating device that they hold to their neck or to their cheek. The other option is to undergo a surgical procedure. So in the whole of their neck that's created, they have a little one-way valve that can help airflow through into the new swallowing tube and create voice. Sounds very throaty. And the third option is to use and learn to use a way of inhaling air through their mouth, trapping it in their throat so they can produce voice as well. Again, it sounds quite throaty, and that technique is quite tricky and it takes a long time to learn. And for some people, it's actually not even possible because of the tissue that's left over in their throat. And in terms of his overall communication, it's interesting to note before surgery that he always had difficulty reading and writing. He had a history of dyslexia, and he really wasn't comfortable with his spelling and using written form of communication. So that was something definitely to note for John. So writing initially wasn't going to be optional, was pointing at pictures or actions to be able to express himself when he couldn't talk. After his surgery, he was understandably he was anxious. He had been someone in retired years. He would go to the pub regularly, his local pub. He'd walk down and have lunch with his mates, play pool. And that really did stop for those months, up to 6 months after his surgery. Initially because he wasn't feeling that well, but also just he was feeling embarrassed and he was really frustrated. And we could see he was frustrated using that electrolarynx, that while it's not invasive, it does sound quite robotic, and it wasn't his voice. He felt frustrated using it. So understandably, there was an emotional dive down after surgery, and really only he communicated with myself as his speech pathologist and his dietitian, his medical team, and his sister. Other than that, the social context really did sort of strip away, and he spent a lot of time at home with his cats. The big shift for him as his main speech pathologist, advocating for John via his surgical team to say, as soon as his tissue is healed enough for that alternate option of a surgical procedure, short surgical procedure, and creating a purposely made puncture for him so that I could place a voice prosthesis in. It's a one-way valve and involves then, with the hole that's here in the neck, blocking that off, that diverts the air into the tube of his swallow tube, his pharynx, and making a noise, making voice. Okay, so there was many moments after that and learning how to do that. His first session was like, his eyes just lit up and he was so excited, and we all laughed because it was just such a wonderful moment. I can create voice by myself again. I can be myself. And every single session after that, following that, of course, there were little hurdles along the way, but his sister started coming to his sessions and telling us how much more socializing. He would call her up and he would speak to his sister's kids on the phone. He went back to being social at the pub. He then went on a course for adults with literacy difficulties and he got an email account and he learnt how to type and joining in this class, and he started to send us emails. And it was just so lovely to see this man come out of his shell of such a life-changing situation, and he was communicating in a written way better than he'd done before his surgery, but also in terms of the surgery and learning a different way to communicate verbally. He just took on that. He was just so confident being able to be independent and go back to the things that he loved to do.